All right, that sounds good to me. Welcome everyone. I'm Reagan Drawlis. I'm an account development leader at ProviderTrust. Thank you for taking time out of your day to join our webinar, Trends, Challenges, and Opportunities Across Provider Credentialing. Couple of housekeeping items before we get started. Phone lines are muted to eliminate any background noise. If you do have a question during the presentation, feel free to type it in the chat and we will address those questions along the way or either save them for a Q&A at the end. We are recording today's presentation and we will send out the recording in an email following the webinar. These are our presenters today. I introduced myself. Donna, would you like to introduce yourself?
You bet. Thanks, Reagan, and welcome everyone. I'm Donna Thiel. I'm the Chief Compliance Officer here at ProviderTrust. I get to often say I have kind of the best job here at ProviderTrust. I get to manage all of the traditional compliance sorts of things and our audits, but I also get to spend a lot of time with our clients and our prospects, really understanding the industry and understanding what's going on. And I spent 30 years in the compliance world in a large health system. So I love being able to stay connected to that and excited to talk with you all today. Tony?
Thanks, Donna. Tony Threet. I've been working within ProviderTrust and our payer space for about 4 years now, helping to build out technology and strategies to assist the payers. Specifically focused recently on our credentialing point of view and how we can use data to best meet the credentialing workflow and meet our payers where they are today. Thanks, Reagan.
Thanks, Tony. All right, quick agenda for today. So overall topic is we are discussing a survey completed or that was distributed by ProviderTrust. So we'll give some background on that, review and discuss findings from that survey, and then discuss some additional industry insights. And like I said, we'll save time for a Q&A session. And we're running for about 30 minutes. So just to provide a bit of context into this survey, it's become very clear to ProviderTrust over the past several years that provider credentialing is becoming a strategic imperative for health plans. So while credentialing used to be just a requirement, it's no longer something that payers are doing just as a requirement. It's becoming an essential part of a larger provider data management strategy. So in the survey, we surveyed 50 participants that all work at health companies, health plans, and they're involved in provider network data management or credentialing in some capacity. So 33 respondents are in credentialing roles. And really what the survey is doing in a nutshell is asking why now payers are elevating credentialing with more attention and strategy than they have in the past. So let's just jump into some of these results. So Donna, over half of our survey respondents, we had 51%, they cited fraud as most impactful to their organization's future approach to credentialing. What is your take on how fraud is driving transformation across provider credentialing, and how are governing bodies addressing that?
I think we're seeing it in a number of ways. And I certainly think when you talk about how our governing bodies enforcing it, and I think about like, what should we be doing, right? As we think about credentialing is more of a point in time, right? We do credentialing every couple of years. And we're missing things in between the cred and the recred process that could potentially create an avenue for fraud, right? We could be submitting claims on practitioners who are no longer licensed or they're excluded. So certainly the traditional, the historical way of doing credentialing just, I think, has a little bit of an inherent risk of fraud. I think when we think about our governing bodies or we think of regulators, one thing that really jumps to my mind is last April at HCCA, the Healthcare Compliance Association, at their annual meeting, the Inspector General always presents at that conference and always has a nugget or two that we walk away from saying, oh gosh, need to pay attention to that. And in this past year, she focused on managed care and really spoke directly to the managed care audience and said, you're all falling behind. Your compliance programs aren't robust enough. You need to look at the people in this room at this conference, and you need to think about how to enhance your compliance programs and think differently about how you're managing fraud. So I always look at that, and I feel like that's kind of a call to action for us, and thinking about how can we do things differently, where should we be looking and thinking. And I think credentialing is a really good opportunity for us to improve upon a process that really hasn't changed for quite a few years and has been relatively a manual and just point in time. And I think that's where fraud potentially comes into that conversation.
Yeah, thank you, Donna. Definitely when we're thinking about the frequency at which providers are credentialed by payers, I think that that's the most obvious opportunity for increasing compliance and credentialing. So instead of thinking in the traditional, we do initial cred and then we re-cred every 3 years, and then we have some ongoing monitoring in between. Our conversations with payers recently have really been around how can we do more primary source verifications in between cred and re-cred, and think of it more as a continuous process that we're doing using a data partner strategically.
Absolutely agree, Reagan. I think that's going to immediately impact your level of risk and ultimately, right, result in less scrutiny by governing bodies related to fraud or waste in that particular case.
Okay, so moving on to the next findings of our survey. This finding is basically that accurate credentialing enables better and more accessible care. So we're saying ensuring accurate and real-time provider network credentialing supports healthcare equity, and it also supports care quality. And it was unanimous among the survey respondents that they agree with these statements to some extent. And so as health plans begin activating strategic directives with more frequent provider verifications and trying to make healthcare more equitable and improve quality of care, they are encountering challenges. Tony, what are some of the key challenges encountered by health plans, and how can technology help address those challenges?
So I think it just follows a quick story, right? If we think about large payers or a payer of any kind, you're organized by contract or market or otherwise, and usually you're covering multiple markets. So the minute you add more groups to the mix that you have to manage or make sure that you're credentialing, is the minute that the complexity of how many across market lines, making sure that you have the understanding of the different requirements for those markets. It just that's a huge challenge. And the groups and organizations that we're talking with have hundreds of thousands of providers that they need to have credentialed during each credentialing cycle. Now, of course, we all know, and luckily that doesn't happen all at one time. It's not like this is while it is an event every time that it happens, luckily it's not, this is the thing we do every April 15th for our entirety of our network. But it does mean that the way that we've understood it to be managed in the past is with people. And you may organize your organization in a way that each market has its own team that does a lot of work. The problem that has, obviously, that means if you're doing lots of markets, you do across state lines, you're doing all these things. Now you end up having teams of by market or by region, and you could potentially have some duplicated work. And of course, there's only so many providers in the country, but if each team is doing the same activities or similar activities, then you begin to have a problem, and it adds time, right? How you then have to back up when you start doing those processes. So it just is a lengthy procedure, and we had in fact heard that specifically from one of the respondents in the survey, right? It's a lengthy procedure, and it's hard to maintain, right? So now Not only are you taking a long time to do it, but it's a lot of different requirements to meet all of the credentialing needs, and that provider is across multiple lines. And so I think the thing that we'd want to think about then, if this is a problem in ensuring healthcare equity and otherwise, how can we begin to look at the multiple sources of data in the verification process and begin to simplify that and use technology in that use case to make the credentialing process better. And in fact, we heard that from one of our respondents as well.
Thanks, Tony. So speaking of the different sources and different tools that can address the challenges that you just described, what we're looking at right now is our survey responses to the question that asked, how valuable would you consider a tool designed to help payers automate the following categories of provider credentialing? So you can see the dark blue is the response is extremely valuable. And then we move into different levels of value until we get to gray and this kind of gold color that are, they don't find them valuable at all. So there's nearly universal agreement that automation is a valuable tool for provider credentialing. Donna, from your perspective, where can plans find the most value in automation? And are there specific sources that you think they should be focusing on over others?
Absolutely. And I think this slide really depicts our opportunities, right? When you think about the credentialing and the re-credentialing process and the different components that we are required to credential, some of that data is static, right? When you think about the work history or education, that's not something that's traditionally changing over the course of time. But then when you look at these components like license verification or certifications, or if you're looking at a board cert, or you're looking at exclusions, all of those things could potentially change on any given day, right? We know that someone's license status could change at any point in time. There could be a board sanction that causes a licensure action that causes perhaps even an exclusion, right? If you follow the breadcrumb trail. So when I think about it, and we talk to folks, oftentimes we hear, oh my goodness, we can't automate everything. We can't do all of that. It's such a huge disruption to our process. I think we have the opportunity to think differently, right? We're not trying to automate everything. I think there's a value proposition of where human beings continue to do credentialing work or re-credentialing work. But when we can leverage automation, when we think about licenses and certs and board actions, those are sources that technology can go out and automate and grab that information and bring back in real time meaningful information, actionable information that then the human beings can interact with that information and take action with the practitioner or gather additional information. But the action of actually going to the board and manually keying something in, returning a license or returning a result is really inefficient. And like Tony was talking before about if your workforce is broken down into regions or states and you have cross functions, someone could be going to the same licensing board 62 times when in reality, automation could do that for them and have one single response that's coming back. So I think really looking at the credentials that could change in real time and have meaningful impact to a change is where I absolutely would be spending my time and where I'd be looking for automation to try to help reduce that burden on your workforce and the literally the manual hours that are going into tracking that information.
Thanks, Donna. So when we're thinking about tools that can automate some of these sources for a credentialing process, we wanted to get clear in the survey on what is most important in that tool aside from just the actual sources. So Tony, will you walk us through where plans place the highest value in an automation tool and kind of how ProviderTrust is equipped to address each of those areas?
Yeah, so we heard in the survey that the main area that folks want to have automation, as Donna was saying as well, is the certificate and license. We also want to be able to monitor in automated fashion the state exclusion lists and board actions. And I think the thing to think about there is just the number of sources that you can go to, the number of specific license types that you may need to collect. When we're going to specific boards, there are things to think about, like the board you're going to, the certificate type you're looking for. Does it require a number or not to perform the verification? Right, all of these things, ProviderTrust has expertise in, because this is where we live every day. But if I were thinking about putting that burden back onto an individual within my organization, I mean, I don't know how long. I've never done a time study about how long it would take to perform a full credential package for someone. But if it takes I don't know, 10 minutes or 15 minutes, and you, because you go to the board and you searched by one thing that you thought that the license type was, and only to find out that's not the license type. So then how much duplication or rework are you having to do because of that potential problem? I think that's why we would lean into automation here and have that happen. I've seen for an entire credential package come back in under an hour with automation. And if I were doing that, then that would allow me to do other aspects of building out that credential package where I could automate those areas. I mean, I think that a couple of things that I would add additionally, right? And I think this is something that folks will have to contend with, is that if once you have the accurate data, and you continuously monitor it, right? I think we've heard a lot in our conversations in the market about, hey, I do this at cred and recred only. But I think that potentially, as Donna said, opens us up for risk, right? Because there are things that happen in between the initial cred and 3 years later for a provider. This is why folks have other things like the NPDB as a part of their cycle, because things happen in healthcare that we want to be able to maintain and have understanding. I think then that last piece I would hold on to is how are you going to get this data back into your source systems? And one thing we know is that as we continue to add in automation, that this data has to go somewhere. And ideally, it goes back into your system of truth, your source system, through an integration of some kind. And I think that as folks continue to think about how they're going to continue to rethink the credentialing workflow, provider data management, thinking about a data partner who is able to integrate back into your source system and bring that data to you is going to be the most something that I would have as something to think about as you move forward.
Thanks, Tony. So looking at interdepartmental information exchange, so 19% of our respondents say data stays within a single department, and 25% say that data is shared between departments only as needed. Tony, what can you tell us about data silos and how they're contributing to data quality concerns and therefore acting as a barrier to these strategic credentialing initiatives?
Yeah, I think it comes down to this, Reagan. One, we know that provider data lives across an organization, right? There are many reasons that an organization and different departments collect different pieces of data to meet certain workflow needs, right? And I may need to collect a social security number in one area, but I may need to collect an NPI in another. And what ends up happening and what we see is that you end up with multiple views of the same person, right? And multiple ways of having that data. What you end up happening is that there's no single source of truth of who a provider is inside your organization. Names is another case, right? You may have the full name in this system, but you may have the nickname in this other system, and you may have an abbreviation in another one. So that happens across teams. And the question, of course, is who owns that data and how does that happen? A lot of folks we're talking to these days are going under a process of trying to get to that singular provider. How do we get to one data provider that then that source information goes across our organization? It's still a challenge, right? We're still in that data reconciliation, system reconciliation process, and that's probably going to be many years in the making. But that's one thing, and the other thing is not just across teams, right? I think one thing that's what we think about and go to often is that, the credentialing team owns this piece of data, but the contracting team owns another, and the provider directory team owns yet another piece. But it's also within a singular team. There may be a singular team that is, because of the way technology was at the time, that has the same product, but a replication of the same product, right? So you may have a provider system or a claim system that is segmented by your market. So even though you're one team, you have to go to different logins of the same product and have a different view of that provider. So, that's a challenge, and it's a challenge of getting to that singular provider with the singular set of data that's truly verified. That is going to be a challenge as we move forward.
So thinking about the different the interdepartmental data exchange challenges, we asked our respondents what exactly is it that prevents them from exchanging information between departments. And so our two key takeaways were different departments have different access permissions and safety protocols, which makes it difficult for us to verify that data remains safe and secure. And then also compatibility issues occur between the departments while data is transferred. So Tony, how can platforms like ProviderTrust consolidate and then integrate across the ecosystem of credentialing data sources?
Yeah, I think that someone like ProviderTrust, but is really apt to help out in this space. But I think the thing that, just to take it away from ProviderTrust, I think that what I would ask those who are listening in today is think about what you're trying to accomplish. And then I think you want to work with a partner that can help you accomplish those goals. And what I mean by that, to be really explicit, is, again, if you have 25 source systems across your entire organization, each of them has a piece of the provider information. You're going to want a partner that can take all of that, help you design a solution that brings all the data together. To then, not only when they bring the data together, we're able to reconcile that data, and then create ultimately what's one provider across your entire organization, that across all markets or contracts or however you're organized, you can see that, John Smith has MPI 123, has, a state license, a DEA, and a board certification. And that builds out that one profile. And then you're going to want that profile, of course, if we're talking about credentialing, to be verified and then sent back into the right source system or systems across your organization. And I think, we do that. We have experience in that. That is what ProviderTrust has been able to do in the market. And I think the one key thing that I'll say again, that was, honestly, maybe a side benefit of the work we do, is our ability to help create that one provider profile. That is not a value proposition I'd say we've sold in the past, but our ability to help folks see across their organization and get insights allows not only for just to know, right, to have the knowledge that this provider is in par, non-par across my entirety of my organization, but then also help to reduce work, because you don't have to then at that point do the same verification 62 times, like Donna said. You can do it once, and that clarity and understanding of a provider is very helpful, and ultimately it's that ability to get that back into your system that helps drive your needs.
Sorry, I was trying to find a way to unmute myself. So moving on to the next subject here, this is the benefits of a hybrid credentialing solution. And the question that was asked in the survey was, how does your organization monitor and verify the credentialing of providers in the health plans network directory? So 47% say that they work with a vendor, such as a CVO. No, I'm sorry, 47% say they do it internally and have a manual process, and 53% say that they work with a vendor partner, such as a CVO. So traditionally, the approach to credentialing has been that either a plan does credentialing manually or works with a CVO. ProviderTrust clients have found a great deal of success in a hybrid approach to credentialing. So Tony, can you tell us more about what a hybrid approach to credentialing is, and kind of what the value is in engaging with a data partner for credentialing versus a traditional CBO where we're passing paper back and forth?
Yeah, I think we've covered a lot of it already, Reagan. And the thing that I would add here is, right, one, look at the extent of the data that you have that you need to verify to build out your credentialing packet. What of that data do you need to have, or what of that data do you have trouble collecting? And that's probably the area that I would say might be the data that you would still have to have a manual process, right? We know about certificates of insurance or other bits of information that you do have to contact the provider. You do have to get that data sent to you, hopefully in an email, but maybe we're still using fax machines, right? To bring it into the packet. But there are things like education. I would hope that education over a period of a provider's career doesn't change, right? That they have always gone to that college or that medical school. And we can verify that at one time. And then the last piece, of course, is the things that Donna brought up earlier, right? We know licenses change, that they change status throughout the 3 years, right? Potentially you have to renew a license every year. Hopefully you renew it on time, but what if you don't? And also what happens if something happens to your license in that period, whether it's a board action that we're able to see, or the status changes, it gets revoked or otherwise. That's the piece that we're talking about that could potentially change throughout that time, that you'd want to have an automated solution. You wouldn't just want it, or we believe anyways, that you don't just want that at the initial cred and the recred. You want to know about the efficacy of your network throughout the process. And that's why you would use an automated solution. You'd use a data partner to help bring in that data in your process throughout the life cycle of your provider. And so if we think about it in those buckets, that's where you would work with someone like ProviderTrust to push that ahead in your organization.
So just outside of provider compliance and monitoring the time in between initial and recred to ensure that our provider network stays in compliance, what other impact does a hybrid approach have on credentialing?
I think from my perspective, just kind of pulling it all together from the things that we've already talked about today, right? It's really an efficiency model, it's a risk reduction model, and ultimately a cost saving model, right? Because if we are identifying a bad actor, someone that's had a licensure change instantly or in a much more efficient time frame than once every 3 years, we're going to get that provider out of our network and reduce our risk of fraud or of billing and losing dollars. So I think there's that side of it. And then certainly the efficiency side of not having redundant work and not having folks having to do all of that manual effort. So I think it improves efficiency, reduces your risk, and hopefully reduces any potential, paybacks or, reimbursement issues that you might have on the health plan side.
Thanks, Donna. So that wraps up our summary of the survey results. Moving into kind of a Q&A section here. Donna, I'm going to hand it over to you.
Awesome. It's 30 minutes, so I think I'm going to jump to our final question, Reagan, if that's okay with you. I think what's a couple of things maybe you can answer jointly. One is, what other things are you seeing in the industry that we haven't talked about today that the survey didn't specifically highlight? But then also I would love for you to talk about how we're really partnering with our clients and prospects on building kind of that business case, use case for switching to a hybrid model. How we, how does that look and feel? Because we know change is really hard, right? And I think one of the things that we're really proud of, right, is our partnership with our clients in trying to really improve processes, not just change for the sake of change. So if you don't mind, Reagan, kind of addressing both of those, I think that'd be great.
Sure. So one thing that wasn't cited in the survey, which I found interesting, was the impact of COVID on credentialing teams. And I just, in every conversation that I've had this year with large regional payers and national payers, they all said that they were impacted by COVID to some extent. So that's getting behind because of the extension on recred timelines and then subsequent staffing shortages, not being able to hire people that have this expertise. And really all of those things just kind of cascading into huge backlog issues is something that everyone has brought up in our conversations. So I thought that was interesting that none of the survey respondents responded that way. But in terms of how ProviderTrust works with our clients, I think, what we want to do first is just really have a thorough understanding of how you're doing credentialing today. How are you doing the primary source verifications? Where do you see opportunities for improvement? And then we would just line item out all of the different requirements and those that we can automate for you. So you've got initial cred requirements, ongoing monitoring requirements, and re-cred requirements. So we would say, out of all of those, this is where we can add automation in. We help create business cases. So looking at the number of FTEs that you have doing that work, just the manual resources that you're putting on that work versus how quickly can ProviderTrust give us this result? What's the level of accuracy? What is the total cost savings there?
Awesome. Thanks, Reagan.
Mhm.
Well, that wraps it up. It's 12:33 in the Central Time Zone, 1:33 for Tony in the Eastern Time Zone. We really appreciate your time today. As always, we love being able to share some insights with folks, and we hope that you found some value in this conversation. And as Reagan said, I believe an email will come out with this recording. And if there's anything that this team can do to support you, by all means, just reach out. We're happy to talk at any point in time. Thanks so much, everyone, and have a great day.